Most people think weak legs mean weak muscles. That's usually not the problem. You can have perfectly healthy muscle tissue and still feel unsteady, heavy, or like your legs might give out at any moment. The real issue is happening somewhere most people never think to look. And if you don't understand it, no amount of exercise is going to fix it. Here's what makes this urgent. Once the system I'm about to explain starts breaking down, everything accelerates. Falls become more likely. Stairs become intimidating. Getting out of a chair starts requiring extra effort or even help from others. And the worst part is that most people don't realize it's happening until they've already lost years of strength and stability they could have protected. Research has shown that the decline in leg function after age 50 is one of the strongest predictors of loss of independence within the next decade. This isn't something that fixes itself. It only gets worse if you ignore it. So let me show you what's really going on, and more importantly, why almost everything you've been told to do about it is missing the point entirely. Mechanism number 1. Nervous system signal loss. Your legs don't move on their own. Every step, every shift in balance, every time you stand up, your brain has to send electrical signals down through your spinal cord and into the muscles of your legs. Those signals tell your muscles when to contract, how hard to contract, and in what order. This system works flawlessly when you're young. But as you age, especially if you're not moving in specific ways that keep those pathways active, the signals start to degrade. Studies on age-related muscle function have found something critical. The weakness people experience isn't just about muscle size. It's about what researchers call neuromuscular efficiency. That's the ability of your nervous system to activate muscle fibers quickly and in the right sequence. Large population studies suggest that people over 50 can lose up to 30% of their neuromuscular efficiency even when their actual muscle mass has only decreased by 10 or 15%. Think about that. Your muscles might still be mostly there, but the signals telling them what to do have deteriorated by nearly a third. Your brain still sends the message, but it arrives weaker, slower, or not at all. The result? Your muscles don't fire the way they should. You feel unstable. Your legs feel disconnected. And even though the muscle is still there, it's like trying to use a phone with a dying battery. The hardware is fine, but the connection is failing. This is why so many people over 50 say their legs feel heavy or unresponsive. It's not muscle loss, it's signal loss. Research has shown that this decline happens faster in the muscles responsible for balance and quick reactions, which is why people often feel unsteady before they feel weak. And if you don't restore that communication, your legs will continue to weaken no matter how much you try to strengthen them. You could do squats every day, but if the nerve pathways aren't firing correctly, you're just reinforcing inefficient movement patterns. Here's what's even more concerning. Studies consistently find that once neuromuscular efficiency drops below a certain threshold, the decline accelerates. It's not linear, it's exponential. The weaker the signal gets, the faster it continues to weaken, because you start moving less, which weakens the signal further. This is one of the main reasons why some people seem to age slowly and maintain their strength well into their 70s and 80s, while others decline rapidly in their 50s and 60s. It's not genetics. It's whether or not they maintain that brain-to-muscle connection. Mechanism number 2. Hip shutdown. Your hips are supposed to be the powerhouse of your lower body. When you stand, walk, or climb stairs, your hips should be doing most of the work. Research on human movement patterns has shown that in healthy young adults, the hip extensors, particularly the gluteal muscles, contribute up to 60% of the force needed for standing from a seated position, and nearly 50% of the propulsion needed for walking. But here's what happens to most people as they age. You start sitting more. You move less. Your job might involve hours at a desk. You drive instead of walk. You take the elevator instead of the stairs. And your hip muscles, especially the glutes and the deep stabilizers, start to shut down. Studies on sedentary aging have found that hip muscle activation can decrease by as much as 40% in people who sit for more than 6 hours a day, and this happens regardless of whether they exercise during other parts of the day. Your body doesn't just let you fall over, though. It compensates. It shifts the load onto your knees, your lower back, and the smaller muscles in your thighs. Those areas were never designed to carry that much responsibility. Research on compensatory movement patterns has shown that when the hips aren't functioning properly, the knees can experience up to 3 times more stress during normal walking, and the lower back can experience up to twice the compressive load during standing activities. So your knees start to ache, your back feels tight, and your legs feel weak, even though the real problem is that your hips have stopped doing their job. Most people never make this connection. They treat their knees, they stretch their hamstrings, they try to build up their thighs, but the hips stay dormant and nothing improves. Large population studies suggest that hip muscle weakness is present in over 70% of people over 60 who report leg weakness or balance problems, but fewer than 20% of them realize their hips are the issue. They think it's their knees. They think it's just aging. They think it's arthritis. And while those things might be contributing factors, the primary driver is almost always hip dysfunction. Here's why this matters so much. When your hips aren't working, you can't generate power. You can't stabilize your pelvis. You can't control your body weight effectively. Studies on fall risk have consistently found that hip strength is one of the strongest predictors of fall prevention, even more so than balance training alone. Weak hips don't just make you feel weak, they make you unsafe. Mechanism number 3, the confidence and movement loop. This one is insidious because it combines behavior and biology in a way that feeds on itself. Here's how it works. You feel a little unsteady one day. Maybe you stumble slightly, or your legs shake when you stand up. It scares you, even if just a little. So you start moving more carefully. You avoid stairs. You hold on to railings more. You sit down instead of standing. And because you're moving less, your muscles and your nervous system start to weaken further. Research on fear of falling has shown that this psychological component is not just in people's heads, it's a documented physiological phenomenon. Studies have found that people who develop a fear of falling, even if they haven't actually fallen yet, reduce their physical activity by an average of 30 to 40% within 6 months. And that reduction in activity leads to measurable decreases in muscle strength, balance, and mobility. Then you feel even more unsteady, so you move even less. This cycle is quiet. It doesn't announce itself. But over months and years, it strips away your strength, your balance, and your independence. And the terrifying part is that once this loop starts, it accelerates on its own. Every week you move less, you lose a little more capacity. And every time you lose capacity, you move even less. Large population studies suggest that people who enter this confidence and movement loop have a 5 times higher risk of severe mobility limitation within 5 years compared to people of the same age who maintain their activity levels. 5 times. This is how people go from feeling slightly off balance to needing a walker in what feels like no time at all. And here's the part that most people don't realize. Research has shown that breaking this loop doesn't require you to suddenly start doing intense exercise or pushing through your fear. It requires you to understand what's happening and then make small, safe changes that rebuild your confidence while simultaneously restoring your physical capacity. But you can't do that if you don't understand the mechanism. Now let me tell you what most advice gets completely wrong, and why following that advice often makes the problem worse instead of better. Walking more. Everyone tells you to walk more. Your doctor says it. Health articles say it. Well, meaning friends and family say it. And look, walking is good for your heart. It's good for your mood. It's good for maintaining general health. But if your nervous system signals are already degraded, if your hips are already shut down, and if you're already in the confidence loop, walking more doesn't fix any of those things. Studies on walking as an intervention for leg strength have shown mixed results at best. Research consistently finds that while walking can maintain cardiovascular health, it does very little to restore neuromuscular function or reactivate dormant hip muscles, especially in people who are already walking with compensatory movement patterns. In fact, if you're walking with poor hip activation and weak nerve signals, you're just reinforcing bad movement patterns. You're teaching your body to compensate in ways that make the underlying problem worse. One study on older adults with self-reported leg weakness found that a 12-week walking program resulted in no significant improvement in hip strength, knee stability, or neuromuscular reaction time, even though the participants increased their daily step count by an average of 3,000 steps. Walking is not a solution to weak legs. It's maintenance at best, and at worst, it's a way to avoid dealing with the real issue. Doing squats or lunges. Squats and lunges can be excellent exercises, but only if your hips are working, your nervous system is firing correctly, and you have the stability to perform them safely. Most people over 50 don't. Research on exercise form in older adults has found that when people with hip dysfunction attempt squats, over 80% of them perform the movement primarily with their knees and lower back, putting almost no load on the hip muscles that actually need the work. So they either do them with terrible form, which increases injury risk and reinforces the exact compensation patterns that are causing the problem, or they avoid them entirely because they feel too hard or too dangerous. Either way, it's the wrong starting point. You can't build strength on top of dysfunction. Studies on progressive resistance training have shown that exercises are only effective when the target muscles are actually being activated, and if your nervous system can't recruit those muscles properly, no amount of repetitions will help. Pushing harder or adding intensity. There's this idea that if something doesn't make you sweat or leave you sore, it's not working. That might be true for a 25-year-old trying to build muscle mass for aesthetics. It is absolutely not true for someone over 50 trying to restore nervous system function and reactivate dormant hips. Research on exercise intensity in older adults has shown something crucial. For neuromuscular re-education and motor pattern restoration, low-intensity, high-control movements are significantly more effective than high-intensity efforts. Studies consistently find that when older adults perform exercises at 60 to 70% of their maximum effort with full attention to form and muscle activation, they see better improvements in functional strength and balance than when they perform the same exercises at 90%. Effort with poor control. Intensity without control just makes you tired. It doesn't rebuild the communication pathways. It doesn't wake up your hips. And it often leads to injury or burnout, which sets you back even further. Large population studies suggest that exercise-related injuries in people over 60 are most commonly caused by doing too much too soon, not by doing too little. Copying routines designed for younger people. Most of the leg strengthening content online is made for people in their 20s and 30s. It assumes you have perfect joint health, full mobility, and a nervous system that's still running at full capacity. But that's not you. And trying to follow those programs doesn't just fail. It makes you feel broken. It makes you feel like your body is beyond repair. Research on age-appropriate exercise programming has shown that older adults require fundamentally different approaches than younger people. Studies have found that exercise programs designed for younger populations, when applied to people over 60, have a dropout rate of over 60% within the first month, and of those who continue, fewer than 30% see meaningful improvements. It's not because you're not capable. It's because the program was never designed for your nervous system, your joint health, or your movement patterns. So what actually matters first? Understanding. You need to know what's really happening, not vague ideas about aging or getting weaker. Specific understanding of signal loss, hip shutdown, and the confidence loop. Research on health behavior change has consistently shown that people who understand the mechanism behind their condition are far more likely to take effective action and stick with it long term. Once you understand that your leg weakness is primarily a nervous system and hip activation problem, you stop wasting time on walking programs and random exercises that don't address the root cause. Awareness. You need to start paying attention to how your body actually moves. Are your hips contributing when you stand, or are your knees doing all the work? Do your legs feel connected to your brain, or do they feel slow and distant? Can you feel the difference between your left and right side? Studies on proprioception, which is your body's ability to sense its position and movement, have found that proprioceptive awareness declines with age, but it can be restored with focused attention and practice. This kind of body awareness is the foundation of everything that comes next. Research has shown that people who develop better body awareness show faster improvements in strength and balance than people who just go through the motions of exercise without paying attention to what they're feeling. Targeted support, not random exercises, not generic routines, specific, intentional movements designed to restore nervous system communication and reactivate your hips. And those movements need to be done in a way that's safe, controlled, and appropriate for where your body is right now. Research on motor learning in older adults has shown that specificity matters enormously. Studies consistently find that exercises designed to target specific deficits, in this case neuromuscular efficiency and hip activation, are far more effective than general fitness programs. You need movements that wake up the dormant pathways between your brain and your legs. You need movements that teach your hips to fire again. And you need to do them in a way that doesn't trigger the fear response that feeds the confidence loop. Let me give you 3 things you can start paying attention to today, right now, that will begin to shift this. First, notice how you stand up from a chair. Do you lean forward and push through your heels, engaging your hips and glutes? Or do you rock forward and push off with your hands, letting your knees do all the work? Research on sit-to-stand mechanics has shown that people who use primarily hip-driven patterns maintain better leg strength and balance over time than people who use knee-dominant patterns. Just noticing this difference is the beginning of retraining the pattern. Second, when you walk, pay attention to whether you feel your glutes working. You should feel a slight engagement in your backside with every step, particularly as you push off with your back foot. If you don't, your hips are likely shut down, and your body is compensating. Studies on gait analysis have found that people with inactive glutes during walking show significantly higher rates of knee pain and lower back pain, even when walking relatively short distances. Third, practice standing on one leg for just a few seconds while holding on to something stable. Not to test your balance, but to feel which muscles activate to keep you upright. Do you feel your hip on the standing side working to stabilize you? Or do you feel tension in your knee and ankle? This gives you immediate feedback about how well your nervous system is communicating with your legs. Research on single leg balance has shown that the ability to maintain single leg stance for at least 10 seconds is a strong predictor of fall risk and functional independence in older adults. These aren't exercises. They're awareness tools. But awareness is where everything starts. Studies on intervention effectiveness have consistently shown that awareness-based approaches, where people learn to feel and understand their movement patterns before trying to change them, lead to better long-term outcomes than exercise-only approaches. When you understand what's really causing weak legs, everything changes. You stop blaming yourself. You stop thinking it's just inevitable aging that you have to accept. You stop wasting time on advice that was never designed for your body, and you start making decisions that actually protect your strength, your stability, and your independence. Research has shown that the decline in leg function is not inevitable. Studies on active aging have found that people who maintain neuromuscular health and hip function in their 50s and 60s show almost no decline in functional capacity well into their 70s and beyond. The difference isn't luck. It's not genetics. It's understanding what actually drives the decline and addressing it before it accelerates. This isn't about turning back the clock. It's about stopping the decline before it takes anything else from you. It's about understanding that weak legs are a solvable problem when you address the actual mechanisms instead of just treating the symptoms. And it's about giving yourself the knowledge and the tools to maintain your independence for as long as possible. In the next video, I'll show you safe, simple ways to start restoring nervous system communication and reactivating your hips. No standing required if you're not ready for that. No strain, no risk, just small intentional movements that address the actual problem. Movements backed by research on neuromuscular re-education and motor pattern restoration. Movements designed specifically for people over 50 who want to rebuild their leg strength from the foundation up. If this made sense to you, you're in the right place. If you've been struggling with weak legs and nothing you've tried has worked, now you know why. And if you found this helpful, leave a comment and let me know. Tell me which of these 3 mechanisms resonated most with you. Was it the nervous system signal loss, the hip shutdown, or the confidence and movement loop? I read every comment, and it helps me understand what to focus on in future videos. I'll see you in the next one.